A very warm good evening to everyone, to all our beneficiaries and respected sir. Today we are here with another webinar focusing on healthcare of the elderly. Our speaker today is Dr. Ashwini Kumar sir, who is a physician working in the CGHS specialist wing under Safdarjung Hospital. Uh, we all know that elderly population is a significant part of India's demography, and we need when we talk about their healthcare, we emphasize not only on treatment but also the preventive and promotive aspects of healthcare. So, without further delay, I request Sir to begin with his session. Sir, please. I request all our beneficiaries in the interim that if there is any doubt regarding the topic, they may please type it in the chat box and we can take it up for discussion at the end of Sir's presentation. Sir, please.
Okay, thanks, Nitya, for nice introduction of the topic and speakers. Today we are going to discuss one of the very important topic of the current scenario, that is the health care of the elderly. We know that the who are elderly, we have to have a definition so that we can say that who is the elder person. According to the United Nations, a person who is over 60 years of age will be considered as a elder person, and it is estimated that by 2030 there will be 34 nations who will have over 20% of population over 65 years of age. Means a major chunk of population is graying, so we have to have a comprehensive healthcare to be developed, and this is the urgent need in India and all over world also. And according to the Indian Census 2011, India have 8.6% of total population that is older. And in this population group, female outnumbers male. So for further discussion, how we can turn our old age into the golden age with healthier habits, we will have all aspects, promotive, preventive, and curative aspects. We will discuss all aspects in mixed language in Hindi English, because our audience is from all over India, so nobody will have inconvenience. First of all, we have to accept that what are the changes which occur when we grow old. So from top to bottom, if we see the hairs become gray, white, and it become thinner as we grow older. And the senses, our senses also response slow. Vision becomes less sharp. The sense of smell and touch may also weaken. Food becomes late appealing, and so nutrition can suffer. And skin with the old age, skin loses its elasticity and start to sag and have wrinkles. Uh, if you consider about teeth aspects, the teeth enamel that protects from decay, it's wear away over the years and leaving you susceptibility cavities and infections. Gum diseases are also more common if after growing older. बूढ़े होने के बाद ये भी दिक्कतें आने लगती हैं. When we consider the change in mouth becomes dry, and the effects of many medications also aggravate this condition of dryness of your mouth, and bone becomes thinner, and they are susceptible for fracture and osteoporosis also. In male, prostate increases in the size, and that may lead to the urinary incontinence frequency and all other symptoms. Urinary bladder have lost control over urination, most commonly in women, and may be seen in men as well. Uh, when you consider the changes in heart rate becomes slower, and the heart blood vessels also become thicker, so they restrict adequate blood flow, and that lead to the reduced exercise capacity in the older age. In concern to the digestive system, the digestive tract becomes slow, and that lead to the constipation and dyspepsia, anorexia. And in brain, we see that we have all have the impaired memory over the years as we grow older. But if it is disproportionate to the age and it hampers your daily activity, then it may lead to dementia also. Along with this, we will see the suboptimal function of liver and kidneys. Now, what are the common health problems in older age? So we can focus more on these aspects. The common problems, one of the important is arthritis. Arthritis, if any patient develop, it affects in many ways, because if a person is having arthritis, he is unable to walk, he is unable to do exercises, that will lead to obesity and increase the chances of coronary artery disease also. So treatment and adequate treatment of arthritis is important. Old age population also may have comorbidity along with them, like COPD and asthma, and control in old age is very difficult because of the adherence to the treatment, and non-compliance is very common in old age. Uh, After this, the cancer is also more common as you grow older. And in eye, we see that the cataract is one of the commonest problem in eye after having certain age. And hearing also decline. Patient may have other comorbidity that is very important and very common, that is the diabetes mellitus. It's adequate control. We will discuss further. Enlargement of prostate may be there. Heart diseases will lead to the other comorbidities, and blood pressure and continence as we do. Now the question arises how to remain fit despite these obstacles. We may delay our aging process and live a quality life. And to do that, we have to have stay physically effective, do whatever exercises possible, and up to the what extent you can do according to comorbidity and other factors. Do daily walking morning and evening as much as possible. Do indoor activities also, like playing ludo, chess, and get yourself engaged in indoor also. Outdoor activities, if you can, then it is better for you, because it will increase in concentration and muscle mass and bone density also. Yoga is the one of the most important part, is because it don't require much of energy and exertion, but it gives a lot of benefits after stretching. It relaxes mind. Along with this, you can continue your hobby also, art and crafts. One of the most important factor to remain is, as much as possible, you have to maintain your BMI between 18.5 to 22.9. इसके बीच में बॉडी वेट रहने से आपको सबसे ज्यादा फायदा होता है, क्योंकि आपको ओबेसिटी भी नहीं होती, अंडर न्यूट्रिशन भी नहीं होता है, दैट विल हेल्प अ लॉट. अगर आपको पहले से कोई आदत है, इफ यू हैविंग हैबिट ऑफ यूजिंग अल्कोहल, स्मोकिंग, देन यू हैव टू रिड्यूस. As you grow older, personal hygiene suffer a lot, because we don't have so much inclination to our not going to the office, not going to anywhere. So personal care severely hampered, but you have to have develop a healthy habit to keep going on. You have to have a hand washing habit after every going to the toilet and touching things, when are uh, eating anything before and after, you should go for the hand washing. Bathing is also necessary. You can have should have daily bath, and care of hair is also paramount importance. Skin and nail is one of the important barrier to prevent skin, particularly to prevent infection. So we have to have take care of skin according to our geographical area. If you are living in cold area, then we have to see, be cautious about the dryness, and apply emollients or other factor as advised by your doctors. And food care is one of the important part in diabetes, because diabetes persons are more prone to develop food ulcer. Uh, Now moving now to what is another important uh, part will lead to comorbidity and mortality, that is the motor vehicle accidents. And because of harmonization, motor vehicles are increasing day by day, and we are used to, are more compelled to use it, and it lead to the more chance of accident in older age, because the sensitivity to glare is increased. One if the vehicle is coming from the front, you are less likely to judge accurately as in young age compared to the young age person. Along with this, old age have poor adaptation and diminished coordination, and your reflexes also become slow as you grow older. To prevent all these factors, one of the important promotive aspect is having a good sleep will have a lot of benefits. Then we have to consider how we will have a good sleep. अच्छी नींद कैसे आए? So some very common and simple facts we can have calculate in our habits, and that will lead to our good sleeping habits. First of all, we have to define our bedtime routine. When you want to go, try to go daily at that time on bed. And moderate physical activity as your capacity in the evening will also improve your sleep quality. And regarding meal, at least you have to have 2 hours before the sleep time meal, because once you sleep, your intestine also sleeps and lead to the lots of problem like GERD, as you know. And in 2 to 3 hours, your foods go down from the stomach, so it reduces the chance of any regurgitation, and its consequential effects also. Further, you have to avoid drinking tea and coffee late in the evening to have a good sleep, because it will lead to anxiety and palpitation, and it may be harmful for some conditions who are having coronary artery. How you will maintain your room for uh, quality sleep? Room should be dark, quiet, well ventilated. And one of the important aspects as we grow older, our sight also impaired. So how to prevent that? We have to have a regular sight test at least annually, and use proper spectacles, not any even from the markets, because sight is one of the important factors of the healthy aging. And except sight, you have to have adequate light in your room and outside. And management of common age-related eye disease like press, myopia, cataract is also paramount. Hearing is another important factors that will lead to the impaired quality of life if it is not addressed at time. So does your family, how you know that you are having a hearing problem? Some of the simple facts does your family member complain that टीवी साउंड इज आउट? जब आप टीवी देखते हैं तो ऐसा तो नहीं कि बहुत तेज आवाज में देखते हैं, लोग कहते हैं कि साउंड कम करिए. डू यू ऑफन मिस योर नेम बीइंग कॉल्ड? आप अपना नाम तो ऐसा नहीं कि लोग बुलाते हैं आप सुन नहीं पाते हैं, या दो लोगों के बीच की बातों को मिसअंडरस्टैंड कन्वर्सेशन, दो लोग बीच में बात कर रहे हैं तो उनको आप समझ नहीं पाते हैं, या घर के लोगों को बोलते हैं कि ये चीज रिपीट करिए, या आपको डोरबेल सुनने में भी दिक्कत आती है. अगर ये चीजें हैं तो आपको अर्ली मेडिकल एडवाइस लेना है. As you grow older, treatment advice we have to follow according to your physician, our physician. And what are simple facts? Avoid self-medication in this age, and don't delay treatment if you are ill. And take proper advice from the health professional, not from everyone here and here. And that is maybe detrimental to us rather than beneficial. Now, how we plan elder care? The need for improved and targeted integrated healthcare approach should be a better. And this integrated approach should be community-based. What the community need is there, and it should be designed about a person, and where the person is living means community of that person. And effective coordination and long-term care system are critical, because once development, its maintenance is also important. So we have a strong willpower to have a development of healthcare and maintenance of healthcare system for the elderly persons. Further, we'll move on toward the preventive checkups. So what should be our goal for preventive checkups, and what should be the proper nutrition of this age, and what is the common psychological problems that will be addressed in the next few minutes. As we know, the preventive services are important for everyone, and when we grow older, it is becomes more important, because we fall more ill after attaining certain age. And this is because your risk of health problems increases, and by preventing problems or identifying them early, you are more likely to live longer, healthier, and more satisfied life and healthy. To do that, what we have to do? We have to provide regular and sustained follow-up, uh, most early detection of complications or changes in functional status, thus preventing unnecessary emergency admissions and healthcare burden, and relative also will not suffer if it detects at early time. It also provides the forum to monitor the progress in relation to the care plan, how our care plan is progressive, and what additional support is needed for the healthcare to have a proper care of elderly. And what are the preventive services? One of the important preventive service guidelines was given by the US Preventive Service Task Force. We usually follow that, and we will not go in more detail. What are the themes of this? It is incorporated in further slides. Preventive services you need depending upon your age and what is the medical history and what is the family history. One size does not fit for all, so that if you it is a individualized approach what you are having, and according to that it's will be found. Preventive services include screening and health advice. Further, overall health and annual wellness examination is one of the important pillars to prevent diseases and early detection. And we have to go for annual height, weight, and body mass index checkup. What medicines you are taking, what you are eating, and what is your activity life. Are you able to do a daily activity or not? And it is a good way to check your health status. Now, the some common problems in elderly are diabetes, which is the most prevalent, as you know, diabetes and hypertension. Diabetes, one out of every four adults who is above 65 years of age and older is suffering from diabetes. So proper treatment and proper follow-up become important to have a quality life. And the other important is high blood pressure. The possibility of high blood pressure increases as you get older. So if you are not hypertensive after 60 years of age, you should have at least annual blood pressure examination. And one of the other important problem is the osteoporosis in screening. Osteoporosis is more common, as you know, in female after 65 years of age because of the hormonal effects we know. And how we check it, this is called a bone density test. So if we think that your clinician think that there is high probability that you have the osteoporosis, we may advise the proper checkup. Another common problem in female is the breast cancer, and the screening is one of the most important aspect and well-proven strategy to prevent breast cancer and morbidity and mortality in the women of elder age group. More than 40% of all new breast cancer, as we know, are approved in the women 65 year of age and older. Women between the 50 and 74 should have a mammograph every 2 years, and it can vary according to family history. You are having a strong family history of breast cancer, and you can do annual examination or as required, ordered by your treating consultant physician. Colorectal cancer is another important factor, and we should look upon that because 60% of the new colorectal cancer occurs in the age of adults 70 years of age and older. The risk benefit and strength vary from different study to different study of the screening method. What you have to do for breast cancer, you have to do self breast examination whether there is any nodule or any swelling or any abnormality in the nipples. Then you should consult your physician or your gynecologist or surgeon. You have to do your skin self examination also if you are developing any mole or increasing size in the previous mole. You should consult your treating physician or family physician. Along with that, Other important aspect is that having a dental checkup. Dental checkup is important because if you are having any dental problem, then this will lead to the your decreased appetite and eating habits, and that may lead to the malnutrition. So, regular dental checkup is also important. Along with that, the obesity and cholesterol checkup is also important. And in female, cervical pap smear is also important to prevent cervical cancer developing. What are the common blood tests we can do for the elderly person? This include the complete blood count with peripheral smear, liver function test, kidney function test, thyroid function test, and not you are not diabetic, random blood sugar will suffice. ECG, urine examination, ultrasound examination of abdomen and pelvis, along with the vitamin D. That is very important because nowadays we all are working. Most of the persons are having vitamin D deficiency. Along with vitamin D, if you are having a tingling numbness or a vegetarian, then you can go for vitamin B12 examination also. Now we'll discuss something about the appropriate nutrition of the elder person. As we know that under nutrition is a common among older people over 60 years of age. Causes may be various because there may be anorexia, there may be constipation, there may be loss of appetite, there may be less taste buds. So all will may aggravate the undernutrition. And along the various previous strategies, the prevalence of undernutrition was found between 1.3 to 47.8. It depends from whether what is your geographical area, what is your socioeconomic status. And as we think that it is higher in low and middle income countries and low high income. Then if we are undernourished, what will happen? What will happen? This can lead to the frailty syndrome. What is frailty? Is a common clinical syndrome in older adults that carries an increased risk of poor health outcome, including fall incidence, disability, hospitalization, and mortality. But how will we will come to know that we are frail or not? In this slide, we will see the five pillars of these characteristics of frailty. That is unintentional weight loss. We can have care about whether our clothes are not, and we can measure the if our body weight is reduced by more than 4.5 kg over last 1 year or more than 10% of your body weight, then you should approach to a doctor for further care and diagnosis and prevention treatment. Weakness. Another method to assess the frailty is the hand grip. This is done by the dynamometer, and it is done for the all person, male and female. The cutoff is different for definitely. Another one of the common person you can feel is that if you are feeling that you are weakness more than 3 days per week, then you can think about you are having frailty or chance of frailty. And if your speed is become slow, how we'll do that? In our OPD setup, we can see that we have a marcation of 15 feet, and you will see that patient is not able to cross it up before 7 seconds. This means that the person is having slowness, and that is also one of the indicator of frailty. Along with that, low activity also predicts that you are frail. Out of the five, you are having three or more criteria present, then you are will be categorized as frail and need special attention to prevent and retard the progress of frailty. And if you are having a score 1 or 2, then you are pre-frail, and it is 0 means you are robust and don't need to be worried at present. Now, in food, what we have to take in food in older age, we have to have a low calorie and low carbohydrate food because we don't need so much calorie, and carbohydrate is not so much required at young age. You can include yogurt, dahi le sakte hain, tomato. You can have fish in moderate. All these fruits and vegetables to be taken in moderate amount. Excess is always bad. any things. Now, what should we take if you are diabetic? Better to have a your diet plan from a dietitian, but if it is not possible, then you should have, and you must be aware of some common things what you have to eat, what you don't have to eat. And your food for diabetes have the certain fruits, vegetables, and whole grains. You can have less fruits and more vegetables in diabetes because vegetables are having less sugar and equivalent nutrients. Fruit like apples, blueberry, cranberry, melons, raspberry should be taken in a small amount, not a big amount. A green or black tea in the morning will be have a great start for you. Tomato nuts are best for before lunch and natural sugar intake of patients of hypoglycemia, and you will have some energy in between the two meals in type 2 diabetes. You should also include spinach, soya, ragi, malt, red peppers, red onions, broccoli, carrots, garlic, and other vegetables in your food also. Now come to the what food should be taken for the blood pressure patient. It should be individualized, and we must remember that salt is not good for the hypertensive patient. It should you should not have a table salts at your the dinner table. Avoid all these like lassi and table salts. And your aim should be less than 1.5 gram of salt per day. And the more sophisticated diet for college dash diet, dietary approach to state hypertension in a diet plan for the patient of hypertension. And it is advised for hypertensive patient to have fruits, vegetables. You can have fruits more here because you are not diabetic, and vegetables as required. And vegetables are very high in potassium, magnesium, and that is good. But if you are diabetes and having kidney disease also, then be aware and take the consultation of your dietitian for your food also. If you are taking more of salt, then one of the very important class of drug you will not effectively, that is the ACE and ARB that like telmisartan most common everybody knows. telmisartan अगर आप ले रहे हैं और नमक कम नहीं खा रहे हैं तो आपका बीपी कम नहीं होगा, दोबारा पाएंगे हमारे पास की बीपी कम नहीं होगा. दूसरा ये कि जो फूड पिरामिड जो है मॉडिफाइड इन ओल्ड एंड यंग एज, डेफिनेटली यंग एज वी हैव a broader base, but we will scrutinize this figure. We will found that water is more important in old age in compared to the young age, and different kind of foods should be incorporated as you grow older to meet your demands. And what should not be taken? You should not take any food that is preserved for the long time because they may have preservative like nitrates that increase the internal and chronic inflammation and has a direct link to the development of atherosclerosis also. Hot dogs should be avoided. Why? Because it is high in saturated fat. And you should avoid the ketchups available in the market because they are loaded with sugar and sodium, and that is mental diabetic hypertension, even in common person also. Further, what should be our food plan? Food can be categorized according to the function as we know energy route foods incorporate carbohydrate and fats, whole grain cereal, millets, vegetable oils, ghee, nuts, and oil seeds and sugars. Another part is the protein part, bodybuilding food that is found in the pulses, nuts, and oil seeds, milk and milk products, meat, fish, and poultry. And most important for the older person food is protective food, that is vitamin and minerals, that is more important you grow older because your intake decrease and so vitamin minerals also consumption decrease. But how we will prevent that? We should have green leafy vegetables, other vegetables, fruits, eggs, milk and milk products, and food should be as much as possible should be fresh. Further, moving to our diet plan, diet should include nutrient-rich food, enable them to fit and active. Vitamin minerals, as we discussed, should be in adequate amount for your healthy and active life. Reduce calorie intake as your lean body mass decreases. Physical activity also decreases with aging. And to prevent osteoporosis, calcium and vitamin D should be supplemented as and when required. In supplementation, I will like to emphasize that vitamin D should be given along with the calcium so that we have a proper their absorption and utilization in the body. And as we grow older, loss of appetite and some difficulty in chewing is inevitable. So we can have a regular checkup to delay that. If you are having a dental problem, then you should have a soft diet with inclusion of fruits and vegetables. Calcium-rich foods like dairy product we should take as much as possible because this is the liquid and nothing to do with the chewing. So if you are having chewing problem, you can increase your calcium by taking the dairy products. Avoid trans fat or hydrogenated oil that is found in more fat food, found in cakes, biscuits, and confectionery. Then what are the other aspects to consider in nutrition? Elderly people should cut down on their saturated fat, sweet, oily foods, salt and sugar. Use of ghee, oil, butter should be avoided. Also avoid eating spicy foods. Well cooked, soft food should be taken and less salt should be. Now, what are the points which should be considered? Each a variety of nutrient-rich food, match food intake with physical activity. आप अपने खाने को अपने फिजिकल एक्टिविटी से मैच करें या किसी डाइटिशियन से प्लान कराएं, अपने डॉक्टर से सलाह लें. और फ्राइड फूड, साइल्ड, स्पाइसी है, हम लोग जैसे डिस्कस किए हैं, इसको अवॉइड करना है. सबसे इम्पोर्टेंट है कि एडिक्वेट क्वांटिटी ऑफ वाटर आपको लेना है टू अवॉइड डिहाइड्रेशन को से बचने के लिए. यहाँ पे ये ध्यान रखना है कि अगर आपको हार्ट फेलियर और किडनी की डिजीज ना हो तो आप एज मच रिक्वायर्ड वाटर ले सकते हो, उसके आप डॉक्टर की सलाह से ही लें. और रेगुलर एक्सरसाइज करें, वॉक करें, स्मोकिंग को अवॉइड करें, टोबैको चेविंग बंद करें, एंड रेगुलर चेकअप करें एज वी डिस्कस अर्ली. एंड ब्लड शुगर, लिपिड का भी इंटरमीडिएट चेक करते रहें. सेल्फ मेडिकेशन को अवॉइड करें. और स्ट्रेस मैनेजमेंट is one of the important aspects of elderly care because as you grow older, your kids are not living with you, or you're more vulnerable to stress management and developing depression, anxiety. Avoid adding salt to your food at table and cooking should be no. And use pepper, lemon juice, herbs, and spices to flavor your food instead of salt. Choose fresh food as often as possible. Limit intake of processed or canned food. Now we have to have a active lifestyle, healthy lifestyle to have a healthy aging. Physical activity, how much we should do? If we are able, we should do at least 30 minutes, 5 days per week. Means 30 minutes is the average. If you can, more is more beneficial. And if you are not able, then you can start from the less. You can start from the 5-minute exercise. You can start from the 10-minute exercise, and gradually you can increase as your capacity increases. Always check your doctor before beginning a new physical activity, and consult a doctor for an individualized diet depending upon medical condition. In the case of persons suffering from chronic disease or bedridden patients. After exercise, what after food, what exercises should be? Should be some aerobic exercises. You can do some stretching exercises, and if it is safe, you can have cycling. You can inculcate it in your daily habits, doing some time yoga. You can spare some times to doing yoga regularly because it is less energy consuming or more beneficial. According to your conditions, you can practice pranayama also. Morning walk is one of the important aspects because you will have a fresh air and it will lead to the increase in your energy and bone density also, and it elevates mood and reduces the chance of depression because you will be in the sunlight that will increase your vitamin D also. Another aspect in old age is the frequent fall. So, everybody that is around 65 years of age, and it is one of the most common or more common. 1 in 3 in older adults experience a fall each year, and every 18 seconds, an older adult is going to the emergency room because of a fall. Every 35 minutes, a person 65 year old age dies due to the fall. So this situation is also grave and should be taken care with simple steps and some precautions. Fall are the one cause of injury-related deaths over 65 years. Fall causes significant debilitating injury and loss of independence. So fall prevention is one of the important aspects of healthy aging. How to prevent it? You have to install handles in your house, use non-slip mats and beds, and install grab bars, repair steps and flooring. Inexpensive fixes you can apply in your house. And how to prevent fall? Keep your body active. Do regular exercise, yoga, and balance exercise along with the yoga, and that will prevent you from the falling. Take your eyes regularly examined by the ophthalmologist at least once in a year. Good vision can reduce your risk of falling. Visit your doctor to review your medication. Avoid medication that make you feel drowsy or unsteady on your foot, like antidepressant, amitriptylines. It's up to your doctors. So get in regular touch with your physician. Make your home safer for elderly. And one of the important aspects, that is the psychological support of elderly person, is the paramount importance for the healthy aging. Despite the expectancy of the life is increasing, it is almost double in India over the 32 years, 1947 to now. It is increased to 63.4 years in 2011. Means over 32 years. It has a life expectancy increase a lot. The elderly population increases here to more than 10% by the year 2021. There is decrease in quality of life due to deterioration of mental health, leading to poor physical well-being also. And one of the important aspect in psychological support is there is a lot of social stigma related to mental illness, and which lead to reluctance in seeking care from health care. That should not be there, and we must have awareness program for that. That it is also a disease like diabetes and hypertension. Mental problem also is similar disease. And what are the common mental problems of the elderly? These are the anxiety, depression, dementia, delirium, suicide, and Parkinson diseases are the common. How to overcome with psychological support, family support is particularly spouse support is of paramount important. And you should also participate in social gatherings to keep yourself engaged and elevate your mood. And you must have the family's support. Nowadays, we are seeing that families are going to the nuclear family. So, joint family was uh, beneficial in this aspect of mental health. And finally, the psychological and medical support from the healthcare is the ultimate need of society at this time. Now, these are the some programs framed by the government from time to time to take care the healthcare need of the elderly population in our country. And the problem statement, the variable degree of mental health morbidity happens in older age. Mental health problems are up to the 43% as against 4.7% in adults. Means that is almost 10 times more mental problems in old age than young age. Mental health conditions are an important cause of morbidity and the premature mortality. So geriatric mental health education should incorporate it in the undergraduate medical examination, and geriatric medicine postgraduate should to be increased over the country to cater the need of the growing population of our country. And we must have the integration of geriatric care services at the community level for its effective implementation. And India has a four type of research to address the geriatric mental health issues. First is since health is a state matter, the first is state funded government psychiatric hospital and private nursing home, private psychiatry hospital and nursing home. And non-government organization are also having healthcare support. A lot of uh, voluntary organization are there which are opening their hospitals, taking care of the need of this community also. And one of the most important part is the family caregiver support. And now this is webinar for the CGHS beneficiary. What is available for healthcare for elderly through CGHS? First, we can approach. You can approach your nearby dispensary, and further you can go for polyclinics. And if preferred, you can see hospital also. Panel hospitals are there to take care of the need of the beneficiary, and IELTS is also there to help the aging process. And OPD treatment and medicine we can get from the CGHS Wellness Center. You can take specialist consultation at polyclinics and government hospital, private panel hospital में भी हम जा सकते हैं. ऐसी हर जगह ये सुविधा उपलब्ध है हमारे आसपास के अस्पतालों में जो CGHS से पैनल्ड है या गवर्नमेंट हॉस्पिटल. हॉस्पिटलाइजेशन इन गवर्नमेंट प्राइवेट इन पैनल हॉस्पिटल्स इनका आपका रिम्बर्समेंट हो जाता है बिल. इसके अलावा CGHS हियरिंग एड भी रिम्बर्स करता है, हिप एंड नी प्लांट भी रिम्बर्स करता है, पेसमेकर और जरूरत कोई होती है तो वो भी कवर होता है. सीनियर सिटीजन्स कैन डाउनलोड. सीनियर सिटीजन को इंगेज रखने के लिए कुछ जरूरी बातें. सोशलाइजेशन ऐप जैसे ख्याल ऐप है, इसमें भी आप अपने को इनरोल कर सकते हैं. आरोग्य सेतु ऐप डाउनलोड कर सकते हैं जो कि मोस्ट पॉपुलर हुआ था कोविड टाइम में. एंड सबसे इम्पोर्टेंट है कि CGHS में ई संजीवनी ऐप जो कोविड के टाइम में लॉन्च किया है अभी भी चल रहा है और इसकी सर्विसेज और बढ़ाई गई हैं जिसको आप ले सकते हैं. घर बैठे आप इसको यूटिलाइज कर सकते हैं. तो ओल्डर के लिए बहुत ही ये बेनिफिशियल है. तो यू कैन हैव रेगुलर हेल्थ केयर चेकअप, टेली कंसल्टेशन आप ले सकते हैं इन संजीवनी में. अभी ये मेडिसिन में ऑर्थोपेडिक्स, IENT, साइकेट्रिक इन ब्रांचेस में अवेलेबल है. तो ऑलमोस्ट मोस्ट ऑफ द आपकी प्रॉब्लम्स इसमें कवर हो जाती हैं. तो नहीं होती हैं उसके लिए आपको प्रॉपर एडवाइस दिया जाता है. यू कैन लॉग इन दिस. It was started by Ministry of Health and Family Welfare. Patients can download eSanjeevani app, and it is a web-based comprehensive telemedicine solution for the patient. And they can avail from their home. So it is very beneficial for old age population. Patient gets a virtual consultation with the doctor, and they can have a detailed discussion of the disease and their prognosis. Doctor then write a e-prescription and patient will get medicine by this prescription. This is the flow chart. You have to install the eSanjeevani app, and with the mobile number you will be registered and a token will be generated. And the SMS will be sent to you and you can log in there and you will enter in the waiting room. And you can further start call when your numbers comes to for consultation on the doctor, and you can discuss. In summary, we can say that the healthcare of elderly is the urgent need of society because life expectancy is increasing, and we are not having so much health care at present available. So we have to expand the health care for the community, and need to incorporate the issues and their possible solution in education curriculum, both medical and formal education. Creation of health group for geriatric population in community and hospital will be a great benefit. Thank you all. I would like to thank my director and additional director, and
Thank you,
now
sir,
we can go.
for
We
that
can go.
wonderful. Yes, sir. Thank you, sir, for that wonderful presentation with emphasis on a lot of topics which our elderly population face on a regular basis but are not talked or discussed very openly, such as the psychological issues and frailty, etc., and falls, which are very common in the elderly population. We had a few queries in the chat box, तो हम हो सके तो वो अभी डिस्कस करते हैं. सर, एक बेनिफिशियरी का सवाल था कि एल्डरली पॉपुलेशन में ट्रेमर्स यानी शिवरिंग बहुत कॉमन है फिंगर्स वगैरह में, तो उसके लिए कोई एडवाइस, कोई प्रिवेंटिव मेजर या कोई सजेशन?
देखिए, जो ट्रेमर हैं एल्डरली में कॉमन है, लेकिन उनकी पहले हमें एटियोलॉजी जाननी होती है कि ट्रेमर क्यों है. फिजियोलॉजिकल ट्रेमर है या हाइपोथायराइडिज्म है या पार्किंसनिज्म है. इसके लिए बेनिफिशियरी को या तो ई संजीवनी ऐप के थ्रू या किसी भी फिजिशियन से एक बार कंसल्ट करना पड़ेगा, ताकि एक बार डायग्नोसिस स्टेब्लिश हो जाए तो फिर तो ट्रीटमेंट हमारे लिए इजी हो जाता है.
जी सर, तो बेटर होगा कि वो एक बार हॉस्पिटल में
हाँ,
कंसल्ट करें और
कंसल्ट करें. हाँ,
उसके
उसका
हिसाब
कारण
से.
क्या है, उसका ट्रेमर का क्या कारण है, वो जानने की कोशिश करेंगे जहाँ पे भी हो जाएंगे.
जी सर. तो एक सवाल दूसरा जो हमारे बेनिफिशियरी ने पूछा था कि जैसे अभी हमने एम्फेसाइज किया क्वालिटी ऑफ स्लीप पे और हाइड्रेशन पे, बट उनका सवाल ये था कि हमें ये कहा जाता है कि सोने से पहले 1 ग्लास पानी ज़रूर पीजिएगा, वो हार्ट के लिए अच्छा होता है, हेल्थ के लिए अच्छा होता है, बट इसकी वजह से बहुत बार रात को यूरिनेशन के लिए उठना पड़ता है, फिर स्लीप पैटर्न इंटरप्ट हो जाता है. तो इज इट मैंडेटरी कि हमें सोने से पहले 1 ग्लास पानी पीना ही जरूरी है, या हम उसको शिफ्ट कर सकते हैं, या कोई ऐसा कुछ?
नहीं, पानी पीना जरूरी है जो नॉर्मल है, ठीक है ना, जिनको यूरिन की प्रॉब्लम है या जिनकी हार्ट फेलियर की प्रॉब्लम है या जिनको किडनी की प्रॉब्लम है, उनके लिए मैंडेटरी नहीं है कि वो सोते समय पानी पिए. वो उनका ड्यूरेशन दिन में भी रख सकते हैं, कोई जरूरी नहीं है कि रात में ही पीना है. तो स्लिप पैटर्न उनका डिस्टर्ब ना हो, इसका केयर रख के वो 2 घंटा पहले या 3 घंटा पहले या 4 घंटे पहले पानी ले सकते. पानी पीना ओवरऑल 24 आवर जरूरी है, अगर वो हेल्दी हैं, ना कि कोमोर्बिडिटी है. कोमोर्बिडिटी के हिसाब से ये यूनिवर्सल रूल नहीं है कि रात में पानी पीना ही है.
जी सर. थैंक यू सर. अनदर क्वेश्चन ऑन द चैट बॉक्स वाज, जब हम साइकोलॉजिकल सिम्टम्स को डिस्कस कर रहे थे, तो बेनिफिशरीज ने कहा है कि एक इरेशनल या फियर होता है एल्डरली पॉपुलेशन में, जो आप कोई पर्टिकुलर कॉज नहीं होता, बट वो इन जनरल थोड़े डरे से और सहमे हुए से रहते हैं, तो उसको प्रिवेंट करने या उसको उसे कोप अप करने के लिए कोई सजेशन, या आप क्या कर सकते हैं, हाउ टू टैकल द सिचुएशन?
देखिए, जैसे हमने डिस्कस किया कि एंजाइटी कॉमन है, एल्डर एज में भी काफी कॉमन है, ठीक है ना.
जी सर.
तो एल्डर एज में एंजाइटी है, ठीक है, दैट्स ओके. बट व्हाट इज द रीजन फॉर एंजाइटी? कोई और दिक्कत तो नहीं है, पाल्पिटेशन तो नहीं होता है, कोई उनको फोबिया तो नहीं है? तो ये सब चीजें एक बार फिजिशियन से मिलकर रूल आउट हो जाती हैं. उसके बाद वो अपना हिसाब से जो भी कुछ अगर लगता है कि ऑर्गेनिक है या नॉन ऑर्गेनिक है, उसके हिसाब से ट्रीटमेंट उनका फर्दर हम लोग करते हैं.
यस सर. दूसरा सवाल था कि सर, जैसे हम कहते हैं कि ओल्ड एज में जनरली बीपी थोड़ा हायर साइड पे रहता है,
हम्म.
तो कोई जैसे 75 प्लस है, तो टारगेट या नॉर्मल बीपी हम क्या लेंगे फॉर 75 प्लस एल्डरली?
देखिए, हम इससे भी देखते हैं कि लाइफ एक्सपेक्टेंसी कितनी है, और बीपी जो कंट्रोल करने का सबसे हमारा मेन कारण होता है, वो स्ट्रोक को प्रिवेंट करना होता है. ठीक है, तो मैं हमेशा ही बोलता हूँ कि बीपी की दवाई लीजिए तो रेगुलरली लीजिए. फिर मैं एक चैरिटी ओपीडी कर रहा था, तो उसमें एक पेशेंट स्ट्रोक आया, तो मैंने उसको इसीलिए बैठा लिया कि तुम यहाँ पे बैठो, यू हैव टू सिट हियर, और लोगों को दिखाओ कि अगर बीपी की दवाई रेगुलर और फिजिशियन से नहीं लेते हो तो लाइफ में एक ही बार होगा, लेकिन ये चीज हो सकती है जो आप भी सफर करोगे, पूरी फैमिली भी सफर करेगी. तो बेटर ये है कि आप अपने फिजिशियन के कांटेक्ट में रहें, कब बीपी की दवाई स्टार्ट करनी है, कब नहीं करनी है, कितनी स्टार्ट करनी है, वो आपको गाइड करेंगे. सेल्फ मेडिकेशन नहीं करना है.
जी सर, थैंक यू सर. काफ़ी रिलेवेंट पॉइंट है कि मेडिकेशन को हम बिना कंसल्टेशन के नहीं स्टॉप कर सकते, या ही उसका ना ही डोज ऑल्टर कर सकते हैं खुद अपने
स्टार्ट और
डिसीजन पे.
स्टॉप नहीं करना.
जी सर. सर, देर
हाँ,
आर
अपने
अ
डिसीजन
लॉट
पर
ऑफ
बहुत सारी कोमोर्बिडिटी हो जो हमें.
कोमॉर्बिडिटीज हैं जो बीपी से एसोसिएटेड है। जी सर, काफी
वही कह रहे हैं कि
रिसेंटली।
हर एक का टारगेट अलग अलग है। अगर डायबिटीज है तो टारगेट अलग है, बाकी कोमोर्बिडिटीज है तो अलग है। उसमें कौन सी मेडिसिन देनी है, अस्थमा है तो कुछ और मेडिसिन हम अवॉइड करेंगे, नहीं है तो कौन सी देंगे, हार्ट रेट कितना है, सारी चीजें एक बार देखनी होती है बीपी की मेडिसिन स्टार्ट करने से पहले।
जी सर। सर, अभी रिसेंटली कुछ गाइडलाइंस सर्कुलेट हुए थे सोशल मीडिया पे भी कि बीपी का जो पहले कट ऑफ 140 एंड अबव लेते थे फॉर डायग्नोजिंग एज हाइपरटेंशन, अभी वो कम हो गया है। तो इसके बारे में कुछ बेनिफिशियरीज ने सवाल पूछा है कि अभी हम कट ऑफ किसको माने, और सीनियर पॉपुलेशन में क्योंकि बीपी जनरली थोड़ा हायर साइड पे रहता है, तो किसको हम
देखिए,
कंसिडर करें?
अभी हमने यही डिस्कस किया कि कट ऑफ जो है वो खुद डिसाइड ना करें, कट ऑफ उनका फिजिशियन डिसाइड करेगा कि करेंट गाइडलाइन किस में कितनी है और किस कोमोर्बिडिटीज के साथ कितना रखना हमें जरूरी है। बीपी का जो सबसे बड़ा फैक्टर ये है कि हम बीपी नापते हैं, जब चल के आते हैं नापते हैं तो जनरली वो बीपी ज्यादा आता है। बीपी नापने का सबसे बड़ा प्रैक्टिकल उपाय ये है कि आप पहले 5 मिनट बैठिए, आराम से रिलैक्स बैठिए, पैर बिना होल्ड किया या एक के ऊपर पैर न चढ़ाएं। वो जो बीपी होता है वो नॉर्मल बीपी होता है, ठीक है। उस बीपी के बाद फिर हम डिसाइड करते हैं कि कोमोर्बिडिटी कौन कौन सी है। तो उसके हिसाब से यूरोपियन सोसाइटी या जो भी है, पेपर में तो एक नॉर्मल गाइडलाइंस आ जाती है, लेकिन वो इतना कम्प्रिहेंसिव नहीं बता सकते कि कौन सी कंडीशन में कितना बीपी का टारगेट रखना है, कौन सी मेडिसिन देना है। बेटर ये है कि फिजिशियन की एडवाइस से ही, रेदर देन कि न्यूज़पेपर या किसी उससे हम स्टार्ट करें मेडिसिन।
जी सर, तो हर केस टू केस हमारा डिसीजन
इंडिविजुअल
डिफर
अप्रोच,
करता है। इंडिविजुअल।
इंडिविजुअल अप्रोच होता है।
जी, बिल्कुल। अ, काफ़ी बेनिफिशियरीज ने ये पूछा है कि इस प्रेजेंटेशन का रिकॉर्डेड वर्जन या पीपीटी मिल सकता है या नहीं। सबके इंफॉर्मेशन के लिए मैं बता रही हूँ कि सारे वेबिनार्स के प्रेजेंटेशंस और रिकॉर्डेड वर्जन 3 से 4 दिन के अंदर सीजीएचएस की वेबसाइट cghs.gov.in में बेनिफिशियरी कॉर्नर के अंडर वेबिनार सेक्शन में अवेलेबल हो जाता है। आप वहाँ से उन्हें डाउनलोड कर सकते हैं और कभी भी एक्सेस कर सकते हैं। दूसरा एक सवाल वेबिनार से रिलेटेड ही था कि कुछ लोगों ने पूछा था टाइमिंग 4 पीएम टू 5 पीएम है, बट कहीं पे 3:30 पीएम टू 5:30 पीएम लिखा जाता है। इस संदर्भ में मैं कहना चाहूँगी कि वेबिनार स्टार्ट प्रेजेंटेशन जो है वो स्टार्ट 4 पीएम को होता है। 3:30 से लिंक एक्टिवेट कर देते हैं ताकि लोग आराम से ज्वाइन कर पाएँ और उस में नेटवर्क ट्रैफिक की वजह से कोई इश्यू ना हो। लिंक 3:30 को एक्टिवेट होगा, बट प्रेजेंटेशन हमेशा 4 बजे से ही स्टार्ट होगी। 4 बजे से 5 बजे तक का प्रेजेंटेशन होगा। सर, और क्वेरीज परटेनिंग टू दिस टॉपिक फिलहाल चैट बॉक्स में है नहीं। तो on behalf of everyone, I thank sir for such a wonderful and detailed presentation. Thank you so much, sir. I thank all the participants for their active interaction and for being a part of this endeavor. We will meet once again on 28th February 2023 with another webinar focusing on the role of Siddha medicine. Till then, goodbye everyone and take care. Thank you.
Okay, Nikhil, thanks everyone, and special thank to our director, additional director, Usman Dureja ma'am, and our NIC team, along with Nitya ji for nice coordination. Thanks to all.